Hi, so first off, a Merry Christmas to everyone, and it's another hyperopia update. As things stand, nothing really has changed. So where we are, these are my distance glasses. They are a mild plus with Polaroid, because I'm kind of sensitive to light, not just sunlight, but ordinary daylight. So I have a little bit of help there, and that's great. These are my reading glasses. Now, normally reading glasses, they're whatever your distance prescription is +2. These are a little stronger than that. These were my original reading glasses, which were exactly that, but they turned out to be not strong enough. I actually couldn't see small print in them. So these are a little bit stronger. They have a mild prism on this eye to deal with my strabismus. I haven't felt the need to get a glaze or any sort of surface on them, or Polaroids or anything like that, even though I do use them at the computer and on my phone. I think maybe I don't use them for long enough, really, and also I've got all my computers and telephones set to a more yellow screen, which so it, I'm cutting down on the harshness of the glare anyway. So these are both working well. As you can see, I still use my +4.25s with an occlusion on the left eye, and these are my +12s, which I have first thing on in the morning and last thing on at night. Okay, so everything's working very well. I'm really managing so much better than I ever did, which is really great. So everything's not quite perfect. I'm certainly very happy with the way things are. It's not perfect. There's still residual problems, because obviously I do need to wear this some of the time. If I'm doing any close work, I mean, I'm fine with my normal distance glasses, for everyday things, but if I do anything requiring more close work, I do need to wear these some of the time. So that leads me on to thinking, well, this seems to be a residual problem that I've always had. So could there be a bit of an issue with the cranial nerves? So the cranial nerves, they're kind of connected to the oculomotor nerves and oculomotor muscles, sorry, and they're the tiny little muscles that move your eyes in various directions. So there's three main ones, and I'm just going to go over what they are. First off, so you got the third cranial nerve, the fourth cranial nerve, and the sixth cranial nerve. And if you have a problem with them, it's called a palsy, which means that the muscles aren't quite working properly, or they're a bit paralyzed. in some way. So to start with the third, and this is just basic Google. So the affected eye turns slightly outward and downward when the unaffected eye looks straight ahead, causing double vision. I don't think I have that problem. The affected eye may turn inward very slowly, which means it has difficulty turning inwards, I think, and may only move to the middle when looking inward. It cannot move up and down. Well, I kind of have a bit of a problem looking up and down, but you know, nothing really big there. And it goes on to say, third, cranial nerve disorders can impair ocular motility, pupillary function, or both. Symptoms and signs include diplopia, that's double vision, ptosis, that's where your eyelid becomes weak and droops. I do have a little bit of this if I've been drinking sometimes, but again it's not much, and that could actually be due to, you know, eye strain in other ways. Paresis of eye abduction and of upward and downward gaze. Abduction is to do with particular muscular actions. I don't know what paresis is, so I'm not even going to guess. If the pupil is affected, it is dilated and light reflexes are impaired. Now, I do have one pupil a little bit larger than the other, but it's not something anyone would really notice. I just notice it. As far as my light reflexes go, this eye, it moves outwards to try and avoid light. So I think the reflexes are perfectly fine, even if the muscles aren't quite working properly. Now we come on to fourth cranial nerve. And it says one or both eyes may be affected. The affected eye cannot turn inward and down. Now that sounds more like the problems that I get with my left eye. As a result, people see double images, one above and one slightly to the side of the other, and that's the sort of double vision that I've had when I get it. It's kind of on the diagonal. Thus going downstairs, which requires looking inward and down, is difficult. Oh yes, that is so me. Actually, stairs and escalators and things have become much easier now. I've got glasses that work for me, but I'd still say going downstairs, it's not necessarily my best, but it's okay now. Okay, so there's a little bit more. People with fourth nerve palsy often have one iris that is higher than the other. I don't know. Maybe not. I just don't know. Tilt their head. I mean, that's a big yes. I have always had a head tilt. I've pretty much always had an issue with going downstairs or looking down at stuff, for sure. I mean, I used to be quite a bit of a daydreamer at school, and it was actually physically looking down at a book, especially if I was writing, because then not only have you got to look down, but you've got to converge your eyes to look at your hand, basically. So that's the looking downward, that has been a long-standing problem for me actually. The head tilt, I've always had that as well. Some types may go away on their own, you may need surgery, blah, blah, blah. Because all of these things, sometimes you're born with it, sometimes it can happen, you know, because you have a car accident or you have an illness. So, you know, these things, they can happen for all different sorts of reasons. Where was I? You may need surgery if it doesn't go away. Well, I think we can pass on that. I'm sure you'd need, you know, a very severe case for surgery. But yeah, the other thing is with the double vision, this is the one where not everyone does get double vision because people learn to compensate with this. And although I can get double vision if you know, I've got very strained eyes, is not a big thing for me, to be honest. It's just, it is that diagonal type when it happens. My eye does tend to float outwards and upwards, and it's always had that tendency, so that is a thing as well, of the fourth cranial nerve. So I do seem to have quite a lot of these things here. So anyway, we're going to move on to the sixth cranial nerve. The most common symptom of sixth nerve palsy is double vision when both eyes are open. This is more common when looking far away or looking in the direction of the affected eye. Well, I mean, the thing about double vision is it is supposed to be when both eyes are open. You can have it in one eye, but because it's often a stereoscopic thing, so it is going to be by and large when both eyes are open. The eyes may also be out of alignment, a symptom called strabismus. Well, yes, I have strabismus. I have a hidden strabismus, but with sixth nerve palsy, the eye has a tendency to turn inwards, and I don't have this problem. So I think that one probably isn't me, but the fourth nerve, that does sound a lot like me. Okay, so what do I intend doing about it? Well, the thing is, I do have stuff that works for me. It can go away on its own, so it may be something that, okay, now I know I have this cluster of symptoms, maybe there is something I could work with here. And I mean, I'm still covering one eye, so that is indicative. Again, that kind of adds weight to, yeah, it could well be that there is an issue with the fourth cranial nerve. Now there are sort of things like eye exercises, prisms. That is another thing. Well, I'm wearing prisms, and that is certainly helping. So now I'd like to come to something a little different with this. Now, I've come across Neal Hallinan's channel, and it's spelled Neal, Hallinan, double L's, and he's got quite a lot of interesting things to say. He's had pretty much the same issues I've had, with teeth, with posture, with head tilt, with eyesight. He's had all these, and he's someone else. He's had to figure a lot of stuff out for himself. So I'm going to definitely watch a lot more of his channel, and see what similarities we got, what I can learn from his channel. But this video that has piqued my interest, it's about breathing with your left diaphragm. So according to him, because he's learned to posture and see and all of that in the way he has, it's like he's got to teach his body a new way of posturing, and a new way of being, and a new way of breathing. And one thing that I find is that when I'm trying to look at things, I kind of contort my body. I do have this head tilt to the right, and I kind of tend to squash my left side up, if that makes any sense. So there is a kind of, okay, so I could start maybe by reminding myself to breathe in on my left side. Now, you're going to breathe in both sides, whether you like it or not. I mean, if you cut off one nostril, you're still going to breathe in both lungs. But if you visualize it, that you're breathing into your left lung while you're doing it, it kind of does go some way to stretching you out again, because you do need your chest to expand fully, both sides. So that is helpful. And okay, with this, because he also had braces like I did, so I've used my splint to help with my teeth, to help with my general posture. So what I found is it certainly does help, but it's not quite fixing the issue. So it does help when I have it on, for sure. And once I've taken it off, the effect certainly does last, which is very good. But what might work a bit better is if I use it maybe for shorter periods, but actually together with some kind of directed exercise. So I put it in, and then I try breathing and posturing, and maybe just have it in for 5-10 minutes while I do an exercise, to try and reset my body. So, I mean, when I've put it in, I've just put it in the hope that it will help. I think if I try and make it a bit more directed, that could possibly have even more benefits. So that is the thing that I will try, for sure. Now, in addition to breathing through your left diaphragm, Neal Hallinan, he's developed a lot of other body exercises like was it abducting your left calf muscle? So it's kind of repositioning your body and becoming aware of your whole body, so that everything's integrated. So it's not just breathing, it's looking at everything as a whole, and the whole thing, like I've said, one thing connects to another, to another, to another. So everything's connected all the way along, and you kind of need to have all the bits in order. So I'm definitely going to watch some more of his videos and report back on that, because I think that could be really helpful. So yeah, that is it. So I hope everyone has a great new year, and you know, have you know, some great resolutions for the new year. So yeah, please like, subscribe, and hope to see you in the next video.